And we can continue with the next workshop. And there's always the question, is pain a disease or the symptom? And I think there are different opinions. Some say maybe, some say clearly a disease. But what did you find out? And you will present the results. Massimo Allegri, welcome him for presenting the results of the second workshop.
Good morning. I'm speaking on behalf of also of Dr. Boaz, Dr. Mario Mauro, and Professor Tolle. And what we had yesterday is very interesting. Sorry. It was a really interesting workshop because we discussed about chronic pain, if it is a disease or if it is only a symptom. So we talk about from the background we saw today. All this stuff, we saw that chronic pain is so common. We saw that in several diseases there is chronic pain, but in many cases, pain often persists past normal healing. So chronic pain could become a disease, and we have to define when it will be a disease or only a symptom. So for that reason, we call on European governments and the EU institution to acknowledge that pain is an important factor limiting the quality of life. We would like to raise awareness of the medical, financial, and societal impact that pain and its management has on the patients and healthcare providers and also on caregivers and family. And we would like to also to raise awareness of the importance of prevention, diagnosis, and management of pain. For that reason, we discussed yesterday several points from an institutional point of view. If pain is so common, and if the incidence or the prevalence of pain is so high, it is important to understand if the management of pain could contribute to fiscal sustainability. Also, especially for Professor De Andres discussed, especially in elderly people. But Commission is obviously willing to address pain, but we need new data and we need good comparable data on pain levels across member states and also new economic estimates of the chronic pain. So, in fact, we have problem with the little data. Also, Professor De Andres discussed in the elderly. There is no a clear incidence of chronic pain. But in the meantime, we need more funding available in next research program. So from a scientific perspective, Professor Tolle discussed very well that chronic pain is associated with other disease, but has on its own differences. And there is not only biopsychological issues, but there are differences and modification of the brain and of the spinal cord. So we discussed also the best practice in Italy, in Spain, Portugal, and Ireland. There are 4 different types of facing chronic pain, and we discussed how Italy, Spain, Portugal, and Ireland faces it, and which are the key issues. And finally, members of parliament discussed it again and stressed very well that chronic pain prevalence is staggering, but the European Parliament is committed to put pain on the agenda and full support for the European program on pain. So finally, what we recommend and what are our recommendations. So the Commission should include pain prevention, primary and secondary prevention, as an integral part of its ongoing work in its chronic disease initiative. The Commission should encourage member states to integrate pain care within the work of joint action on chronic disease we saw in a speech today. The Commission should also consider implement, where appropriate, the expect trio council conclusion on finding non-communicable disease, and pain is a very important disease in non-communicable disease. And another thing is that should issue calls for proposal to develop knowledge of the diagnosis, prevention, and management of chronic pain as disease by itself. So this is really important to understand when chronic pain is a disease by itself. Furthermore, the Commission should create a platform to concerned parties at EU level to ensure the integration of basic science and clinics, And the European Commission should facilitate the development of European quality criteria for pain. And also, it is important to development of European quality criteria to develop, to understand when chronic pain is a disease. Finally, the last slide. National governments should develop multidisciplinary patient-centered strategies to appropriately manage chronic pain. This is really important because we understand that if we do not face chronic pain in a multidisciplinary way, we cannot fight pain. National governments should develop guidelines and recommendations to address chronic pain management and to address chronic pain as a disease. National governments should design policies focused on self-management to empower people with chronic pain to support themselves. This is very important. Pain is something that patients suffer, so it is really important to understand patients and to support patients to their empowerment. National governments should prioritize pain care within all healthcare professional education and training. We discussed a lot about that. It is really necessary to improve the pain education, not only in the healthcare provider, but also in patients. And finally, national governments should initiate patient education programs, trainings, and information campaigns in order to create public awareness of the consequences of chronic pain. Thank you very much.
Thank you very much, Massimo.